Moving on to longitudinal chordad of the glenohumeral joint. To start off with, what we have to do is take out any motion of the scapulothoracic. So therefore, what we do is from up the top here with my right arm, is we depress the shoulder. So you hold on to this their forearm with the opposite arm, and you depress the shoulder, and then just a very slight pull on this hand, just to keep it in that position. Then this arm comes down and onto anterior of the forearm, and we line up our forearm with the humerus so that we can apply a force longitudinally towards the toes, essentially. So longitudinal chordad. So what we're going to do, we've taken up most of the slack, and therefore we're going to apply our force. Now, quite typically, this movement is reserved usually for patients that we need to get into some form of resistance with when we're doing this. You can do it as a grade 1 and 2, but this is probably not the ideal handling for it. It's quite a powerful handling position. Okay, just take their arm just slightly off the bed so that you're not dragging against the bed either. Okay, so we're going to start the motion now. So I'm going to do a test movement into my motion. We're already really taken up the slack. So I'm going to go into resistance a little bit, back off slightly, take it a little bit further, going for my end of range. Okay, and at any point that they've said that there was pain, that's when I would do my motion. So let's just say we're going to here, and they say, yeah, I can feel that now, it's a bit of a stretch. Just going to back off and then perform a grade 3. And equally I could do a grade 4. So we're going towards the end of range. Here's my 4. So pretty small, isn't it? Small movement. For AP and PA of the glenohumeral joint, passive accessory movement, for doing an AP, because of the orientation of the scapula and therefore the glenoid fossa, doing a true AP where we push straight down, there's a bit of an issue with it in terms of, because the glenoid is facing forwards and we have the humerus sitting in here, if we do a pure AP, we tend to then pound it into the joint surface. So therefore it's much nicer if you can come away at an angle of around 30 degrees or so, so rather than doing a pure AP, you actually come out towards the side. To do that, it's therefore slightly easier, I find, if you do it in the opposite arm to the side that you're standing. You obviously need to make sure that you're looking after your back, that you're using your legs, that you're bending your knees and bringing yourself down and over and across, using the bed as well as a certain level of stability for you. So to perform it, hand comes underneath so that we stabilise the scapula, because we need to be able to feel for any motion in the scapula and pull it up against the motion as we're applying our pressure down. And then we're going to feel for the humerus. Okay, so I can feel bicipital groove, greater and the lesser tubercles. And then that's where I'm then going to place the anterior aspect of my hand and curl my fingers round the side. Now some people are quite happy just performing an AP this way and just pushing on the front surface of the bone. I find if I just put my fingers round, whilst they're not doing anything, it actually gives you a sense that you've got that bone in your hand and gives you more of a feeling of what it's doing. So I'd highly recommend you curl those fingers round. So then stabilising with this hand underneath, my right hand, left hand is going to do the motion. So I'm gripping nice and firm with my right, squeezing my hand with my left, and then I'm going to apply my motion. Okay, so we're going to do it in the 1, 2, 3. So we're just going to try and take up the slack, start off with, see if it causes them any pain. No pain. Back off slightly, go slightly further into resistance now. No pain there, back off, but I'm still in resistance. And now I'm pushing for the end of range. Okay, when performing it that slowly, you don't really see very much of the motion. So I'm now going to go into doing, I'm going to go with a grade 3 because I can probably show you the most amount of motion in this instance. Okay, so taking up the slack, pushing in further, pain is just there, so I'm going to back off, and then perform the technique. There's almost like a slight sense of a scooping as you're doing this. You're kind of scooping like that as you're doing it. Just try and get that ball gliding in the joint. Okay, for PA, same position, same handling. This time though, we're going to try and bring the humerus forwards. So again, rather than just coming purely forwards, we're going to follow that same line of path going across the body. So this time we need our hand to come onto the front to try and stabilise essentially the clavicle right the way out towards the acromion, just making sure we're not getting in the way of the humerus. Then the hand comes round, but we're much more, there's a much greater need therefore for the firmness of your fingers applying the pressure on the posterior of the humerus, with the rest of the palm of the hand coming onto the front, really to give us again that sense of feeling for what's happening with the humerus. Okay, so now my right hand here, I have to apply a pressure down just to stabilise, keep everything nice and locked, and then my left hand is going to do the motion. So taking up the slack initially, no pain, back off, come into resistance, no pain, back off slightly, and then we're going to go for our end of range. As we apply more pressure up, I'm having to push more down with my right, and that'll be a normal motion. If we're performing a technique, so again I'll go for a grade 3 because it's much easier to see. Okay, so taking up the slack, into resistance, and then we're going to start our 3 from there. So what you'll notice is, very similar to me doing my AP, it's just the emphasis now is bringing the humerus forwards rather than pushing it backwards. It's the same plane of motion. And there we go.